Hello everyone, I'm Dr. ATTUNE. Welcome back to our cozy corner of knowledge where we demystify the ATTUNE study.
And I'm Dr. Dupree Mekbing. Before we start our presentation, make sure that you have watched the first part of this webinar in which we explain the steps in drug development and the ATTUNE study design. As for part 1, be aware that you can activate subtitles in your preferred language. After watching the full video, you can reach any of the topics anytime by selecting the desired chapter. You can also leave your comments or write down new questions using the link below.
Now, let's continue. Shall we?
Let's start by exploring the content of this second part.
In this episode, we'll cover the medical procedure for administering ATTUNE 440, explain the sham control group, and discuss the expected benefits of ATTUNE 440. Then we'll cover costs and general communication, the next steps after ATTUNE, and how families can get involved now.
All right, I think we are now ready for presenting our first topic.
Any medical procedure can be a source of anxiety for caregivers.
This is why it's crucial for parents and caregivers to fully understand what it entails and the steps involved. So, let me explain how ATTUNE 440 will be administered during the ATTUNE study. As mentioned in part 1 of this webinar, ATTUNE 440 is an investigational antisense oligonucleotide, or ASO, that was specially designed to bind and destroy the MECP2M RNA, thereby reducing the overexpression of the MECP2 protein. As many of you know, children with MECP2 duplication syndrome experience symptoms such as seizures, communication issues, movement problems, reduced gut motility, aspiration, and infection. These symptoms are all regulated by the central neurological system, meaning our neurons and brain. Although the overproduction of the MECP2 protein occurs throughout the body, it's the overload of this protein in the brain that causes many symptoms in patients with MECP2 duplication syndrome. It is therefore in the brain that ATTUNE 440 should be delivered and act.
Delivering a drug to the brain is not an easy thing, right, Dr. Mekbing?
That's correct. Our bodies have a built-in security system to protect our brains. The brain and spinal cord are surrounded and safeguarded by cerebrospinal fluid, which is enclosed by the blood-brain barrier.
This barrier allows only certain substances to pass through. It protects the brain from harmful substances and infections, but it also makes it difficult for many medications to reach the brain when taken orally or through regular injections.
When doctors need to deliver medication directly to the brain or spinal cord, they usually use either an intrathecal injection or an intraventricular injection. Intrathecal requires a lumbar puncture, whereas the only way to deliver a medicine intraventricularly is through brain surgery. These two methods ensure the medication reaches the cerebrospinal fluid and consequently the brain and spinal cord, without being blocked by the blood-brain barrier. In the case of the ATTUNE study, ATTUNE 440 will be administered intrathecally.
Similarly, examining what happens in the brain and spinal cord can be achieved by withdrawing and analyzing the cerebrospinal fluid. This is done using a technique called a lumbar puncture or spinal tap. For the ATTUNE study, both CSF sampling and injection of ATTUNE 440 are being done during the same medical procedure. Let's have a look now at how exactly both the lumbar puncture and ASO injection will be performed for patients enrolled in the ATTUNE study.
The injection site is typically in the lower back. First, the patient will be positioned lying down, usually in a slightly curved posture to open up the spaces between the vertebrae. The injection site and surrounding area is cleaned and sterilized to minimize the risk of infection. Then a thin, sterile needle is inserted into the intrathecal space between the vertebrae in the lower back. At this point, the cerebrospinal fluid can be collected for analysis. In the case of an intrathecal injection, the medication is slowly injected through the needle into the intrathecal space, meaning between the vertebrae. Once the CSF has been collected or the injection is complete, the needle is carefully removed, and the injection site is covered with a sterile bandage. It's important to note that the body produces and absorbs CSF regularly, maintaining a constant balance. The small amount of CSF withdrawn during a lumbar puncture is quickly replenished thanks to this natural process. As you might imagine, it is very important not to move during such a procedure because it could damage the spine and create irreversible damage. Therefore, for patients who cannot cooperate, such as people with MDS, the intrathecal injection and lumbar puncture happen under some sort of sedation. The mildest is a gas sedation without intubating the patient. An intravenous line might be placed for fluids or drugs that help reduce nausea that can be caused by the sedation itself. The most advanced sedation requires intubating, meaning putting a tube to throat and giving sedation medications intravenously. Mostly hospital policies determine what type of sedation is performed. A lumbar puncture, which allows for collection of the CSF for analysis, is included as a control step in the ATTUNE study protocol. It will be performed every time an injection of ION 440 is scheduled. In part 1 of the study, 75% of people will receive ION 440 after the lumbar puncture and CSF collection. In the sham group, which represents 25% of the participants, the procedure will stop with the lumbar puncture and collection of the CSF, and no ASO or any other solution will be injected. We will come back to this point later. During the second part of the study, everyone will have a lumbar puncture to collect cerebrospinal fluid and to inject ION 440.
Safety and well-being of patients involved in ATTUNE is of high importance to Ionis. Patients and caregivers will be gently prepared for the medical procedure. Depending on the study site, caregivers may have the possibility to stay with their loved ones until anesthesia has been administered. This may differ at each site. Because ATTUNE is a double-blind study, the caregiver won't know if the patient receives ION 440 or a sham until part 1 of the study is completed by all participants. In addition to the medical procedure, participation in ATTUNE will necessitate multiple site visits and remote assessments at regular intervals.
Prospective participants will learn more about the total number of visits, including the expected number of overnight stays, during the screening and informed consent process.
Why don't we have a look at what may happen during visits, Dr. Mekbing?
Yes, it's a good idea, Dr. ATTUNE.
Some in-person visits may require an overnight stay at the study site. During these visits, multiple tests may be performed on participants and their caregivers. The frequency of the tests will be discussed with the hospital team. Let's go through each test one by one to better understand what these imply. A blood draw and a lumbar puncture may be performed to look at specific parameters and biomarkers, either in the blood or in the cerebrospinal fluid. Physical and neurological examinations, and vitals including measurement of blood pressure, heart rate, respiratory rate, temperature, and measurements may be part of visits. Electrocardiogram or ECG may be included during a visit. ECG is a procedure that measures the electric signals of the heart. In some cases, electrodes will be placed onto the chest and electrical signals will be recorded. In other instances, children will be required to wear a device called a Holter monitor, which will continuously record signals for a maximum of 25 hours. If children will not tolerate wearing a Holter monitor for a long time, the hospital might use a simple ECG. An electroencephalogram may be part of the visit. This is a test used to detect the electrical activity of the brain. Brain cells communicate by producing tiny electrical impulses. During the EEG, children will be fitted with an electrode cap that is placed around the head, ears, and face. The cap is connected by wires to an amplifier and electronic recording machine. The recording machine converts the electrical signals into a series of wavy lines recorded on a computer and visualized on a screen. Children will be asked to sit still, because any movement can alter the results. A brain MRI may be part of a visit. It allows doctor to look at the structural changes of the brain. A brain MRI scan uses a large magnet to obtain images of the brain. The MRI machine looks like a large tube with a table that slides into the machine. Children will be sedated and will lie on their back on the table that will slide into the MRI scanner. The procedure may take between 30 and 45 minutes. Children may also need an injection of a dye called a contrast agent. Skin biopsy may be included if it was not done as part of natural history study. A skin biopsy consists of removing a small sample of skin to measure the level of MECP2 protein. It may be taken during the baseline visit if not previously collected, while children are under anesthesia. Pupillometry may be performed. For this test, doctor, optometrist, or ophthalmologist will use infrared videography and eye position tracking software to determine how the pupils of children's eyes respond to light. It takes approximately 5 minutes to complete pupillometry. And finally, survey and diary review completed by the caregivers may be reviewed during a visit.
Caregivers will receive trainings from the hospital team on how to monitor and report any side effects or adverse events that may occur during the study. They will also be instructed on how to enter their responses to the electronic questionnaire. This training will allow caregivers to actively participate in the data collection process and ensure that accurate and reliable data is gathered during the trial.
During the course of the study, caregivers should of course consult with their healthcare professionals and the study team if they have any questions or notice any effects between assessment visits.
Remember, clinical trials are essential studies that contribute to the advancement of medical knowledge and the discovery of new treatments. They provide hope for individuals and families affected by rare diseases.
ATTUNE 440 is an investigational medicine and has not been approved as a treatment for any disorder, including MDS, in any country. Additional information will be provided by the hospital team during the recruitment process, and caregivers will have the opportunity to ask any questions throughout the study.
Let's continue now with the mode of injection of ATTUNE 440 during the ATTUNE study. Dr. ATTUNE.
During a trial involving intrathecal injection, pain is an important aspect to be considered. It is important to know that as patients will be sedated during the administration of ATTUNE 440 to prevent them from moving, no pain during injection is expected. Once the sedation wears off, it is possible that the patient may feel pain at the injection site or in the surrounding area. The duration and intensity of the pain can vary depending on the individual's sensitivity and the nature of the injection. The patient will be monitored post-sedation and will be provided appropriate pain relief if necessary. In terms of side effects, intrathecal injection can have both local and systemic effects, meaning side effects that could happen anywhere in the body. Local side effects may include pain at the injection site, headache, or infection at the site, while systemic side effects can vary depending on the medication being injected and may include allergic reactions, neurological symptoms, or other adverse events. As you may recall from the chapter on clinical trials, one of the research questions of a Phase 1-2 trial is to identify the side effects. The approval of a drug takes into account its benefits and risks. While drugs may have various side effects, the decision to approve them for market use is based on a thorough evaluation of their overall benefit-to-risk ratio, meaning how severe the side effects are, in comparison to the disease evolution itself without treatment at all.
Now that we have reviewed the medical procedure for the administration of an ASO, let's talk about the concept of a sham. We understand that this concept of control group may raise questions, particularly regarding the difference between a sham and a placebo. Dr. ATTUNE, could you please explain this to us?
Yes, of course. Let me just start by defining what placebo and sham are and why a sham is preferred for ATTUNE. A placebo is a fake or dummy treatment that looks identical to the real medicine but does not contain any active ingredients. It is used to compare the effects of the actual drug being tested and determine if the drug has a real benefit beyond the psychological impact of receiving a treatment. On the other hand, a sham procedure refers to a fake or dummy procedure. It mimics the actual medical procedure, but no placebo or active drug is administered. It is used in clinical trials to control the effect of the surgical interventions to ensure that the results are not influenced by the expectations of the patient or doctor.
In summary, the main difference between a sham and a placebo is that a sham is a fake procedure where the patient doesn't even receive a fake drug, while a placebo is a fake treatment which includes receiving a fake drug. They are both used to make sure that the results of a study are due to the treatment being tested, and not because of other factors like a patient's or doctor's expectations, or by the surgical procedure itself. During ATTUNE, enrolled patient that will receive a sham during the study will not be injected with a fake drug. During the lumbar puncture, medical staff will withdraw some CSF but will not inject ION 440 or any fake drug. After CSF withdrawal, the needle will be removed and no injection will occur. Since MDS patients do not routinely undergo general anesthesia or lumbar puncture as part of their standard of care, it is preferable to have a control group to be able to differentiate events from the natural course of the disease or the intervention itself. Dr. ATTUNE, could you please tell us now how patient will be assigned a sham procedure in the first part of the study?
ATTUNE is a double-blind study, which means that neither the participants nor the researchers, nor the company sponsoring the study know who is receiving the real treatment and who is receiving the sham. A randomization algorithm will determine whether a participant will receive ION 440 or a sham during Part 1 of the study. As you may remember, in Part 1, 75% of participants will receive ION 440, while 25% of participants will receive a sham. For Part 2, all participants, regardless of whether they are receiving ION 440 or sham during Part 1, will automatically move to the cohort-associated dose. Let us illustrate that with an example. After completion of Part 1, participants receiving a sham in the cohort dose A will move to Part 2 and receive an injection of ION 440 at dose A. Similarly, a patient receiving a sham in the group for dose B will receive, after completion of his Part 1, ION 440 at dose level B, and so on. When all of the participants complete the first part of the study, it will be possible to unlock the data, and everyone will be able to find out which treatment was being received by each participant in Part 1.
Now that we know how patients will be enrolled, randomized, and receive ION 440 or a sham, let's talk about the anticipated benefits of ION 440 on the health of MDS patients, Dr. ATTUNE. The primary objective of the ATTUNE study is to assess the safety and tolerability of ION 440 at different doses. It is important to note that the efficacy study is not part of the ATTUNE study,
meaning it is not intended to look at the efficacy of ION 440 on the symptoms of MECP2 duplication syndrome. That doesn't mean that the study isn't looking at efficacy at all.
Exactly. The clinician and caregiver assessments will provide information on early indicators of efficacy across many different symptoms. And this is important because it will help Ionis understand what an efficacy trial later on needs to look like, meaning how many patients will be needed, how long the next trial will need to last for, and what types of improvements may be observed in individuals with MDS. If the safety of patients during Phase 1-2 of the ATTUNE study is not established, meaning if there are a significant number of patients experiencing severe or life-threatening adverse events that are difficult to manage, the study may be stopped, and further research might be conducted to improve the drug.
On the other hand, if the drug is well tolerated and safe after analysis of the results from all patients enrolled in the Part 1 of the ATTUNE study, Ionis may decide to proceed with ION 440 to the next phase, Phase 3, where Ionis could formally evaluate the efficacy of the test drug. After alignment with health authorities, it is during Phase 3 that researchers may assess how ION 440 affects the symptoms of the syndrome.
Once again, I'd like to remind that the success rate of clinical trials for rare diseases is generally quite low, estimated to be around 6 to 10%. While this may seem discouraging, it reflects the challenging reality of transitioning from promising results in animal to unpredictable outcomes in human trials.
Can you tell us a bit about whether ION 440 is safe? For example, what was observed in preclinical animal models, Dr. Mekbing?
With pleasure. ATTUNE 440 has never been tested in humans, so we don't know whether it is safe in humans. However, preclinical studies were performed before. This means ATTUNE 440 was administered to animals such as monkeys and mice. Animals were treated with ATTUNE 440 at much higher doses and more frequently than what patients will be given in the ATTUNE trial. During these experiments, no abnormal findings were observed. Giving monkeys high doses of ATTUNE 440 for 13 weeks was well tolerated. It indicates that there is no identified risk associated with doses of ATTUNE 440 that will be given in the ATTUNE clinical trial. At the moment, Ionis doesn't have information from animals treated with ATTUNE 440 for more than 13 weeks. But Ionis will have that information before anyone enters the long-term extension or Part 2. This means 2 studies, one in mice and one in monkeys, that are looking at the long-term effects of ATTUNE 440 in animals are ongoing. And any data that may impact your decision to continue participation in the study will be provided to you as it becomes available.
Thank you, Dr. Mekbing, for the complement of information. To summarize, ATTUNE is the first human study of ATTUNE 440. Its primary goal is to evaluate the safety and tolerability of ATTUNE 440 in people with MDS. It is not designed to determine the efficacy of ATTUNE 440 as a treatment for MDS. Data from the first part of the ATTUNE study will provide information and help design potential future studies, which may include additional clinical trials, such as those designed to determine the efficacy of ATTUNE 440.
Ionis is committed to keeping the MDS community aware of advancements in its research efforts, but it is premature and inappropriate for Ionis to speculate about a timeline. Ionis will share results from ATTUNE when it is appropriate to do so. However, it is not expected that the results will be shared before the study's primary completion date, which is currently projected to be June 2026. Please note that these dates are subject to change. Ionis will update this date on clinicaltrials.gov as necessary in the future.
We are touching an important point, Dr. Mekbing. The communication, shall we talk about this now?
We understand that families affected by MDS form a small community that networks globally through various communication channels. Families exchange thoughts, tips, and tricks on diverse topics. It's crucial to note that when a patient enrolls in a clinical trial like ATTUNE, confidentiality becomes a significant aspect of the process for many reasons. Prospective participants will learn more about their confidentiality obligations during the screening and informed consent process. Once enrolled, they should direct any additional questions about what they can share with others outside the trial to their respective sites.
Communication about observations via social media or any other channel will not be permitted.
For the integrity of the study, it's essential to strictly adhere to the rules set out during enrollment.
I have seen recurring questions from families about the types of costs that Ionis will reimburse and health insurance for ATTUNE participants. Can you help answering these questions, Dr. Mekbing?
Yes, of course. Participants of ATTUNE will receive information about reimbursement for study-related expenses from the hospital where they enroll. The site staff will guide them on the types of expenses that may qualify for reimbursement and the process for submitting reimbursement requests. Please note that such reimbursements may be considered as taxable income in some regions. Common reimbursements could include transportation from home to the site, as well as food and accommodation during site visits. Families who have additional questions about health insurance coverage or other costs related to potential adverse events from the study are encouraged to speak with the study site about their concerns.
Thank you, Dr. Mekbing. We've covered a lot of ground in this webinar about the ATTUNE study. Now, let's talk about the next steps in case ATTUNE 440 successfully passes Phase 1-2. As we have mentioned, it's impossible to predict the success of a clinical trial, but let's discuss the potential next steps.
In this section, we will address 2 questions. What comes after Phase 1-2 and what could be the cost of such a treatment if it reaches the market? Is it affordable? Will health insurance be willing to cover such costs?
Clinical trials are research activities and are not designed to provide indefinite access to investigational medicines. This means that participation in ATTUNE does not guarantee a person access to ION 440 for the rest of their lives. The study has an end date, which is currently projected to be in 2030 as listed on clinicaltrials.gov. Any changes to the study's timeline will be communicated to participants and the public at the appropriate time in the future.
Data from ATTUNE will give information on potential future research, which may include additional clinical trials, such as those designed to formally determine the efficacy of ION 440. Ionis has confirmed that they are committed to keeping the MDS community informed of advancements in its research efforts whenever it is appropriate to do so.
Once a drug has successfully passed phases 1, 2, and 3 of an interventional trial, it may be submitted for regulatory approval for commercialization for a specific disease or set of symptoms. This approval is country-specific and controlled by local health authorities, not by Ionis.
Exactly. Then when a drug is approved, access to medications may also be managed at the country level or by specific insurers, not by Ionis.
That's a crucial point, Dr. Mekbing. This means that the potential availability and coverage of the treatment may vary depending on the country and the specific health insurance plan of the patient.
Also, determining the price of a new drug is a complex process that considers many factors, including the cost of research and development, manufacturing, marketing, and distribution. Given this, it's very difficult to speculate pricing for any one specific drug.
That's right. It's impossible to compare the cost of this treatment with other existing ASO treatments on the market due to the unique characteristics and development process of each drug. Well, with this I think we covered all of the topics, Dr. Mekbing. But I would like to address one last very important aspect. I want to strongly encourage families and caregivers who have more questions or concerns to share them with us. We'll continue to keep the MDS community informed of any advancements in Ionis research or updates on the ATTUNE trial.
I also want to remind everyone that there are many ways families can contribute to advancing research beyond joining ATTUNE. If you're in the United States, you can help deepen our understanding of MECP2 duplication syndrome by participating in the natural history study or by sharing your loved one's medical data through Citizen.
Also keep an eye out for MECP2 Europe-based register and survey platform, where you'll have the opportunity to actively contribute. This platform will enable the registration of MDS cases and facilitate the centralized collection of data from caregivers and researchers to advance research on the syndrome. Currently in its testing phase, the platform is expected to launch in early 2025. As we close out this webinar, I want to take a moment to acknowledge the incredible team that made this possible. This webinar has been created by MECP2, a European organization for MDS.
We're also grateful to the families who shared their questions with us, allowing us to address their concerns.
I'd like to thank the team at Ionis for their invaluable review and feedback on the content.
A special thanks to Katie Westerniel, David Covini, and Davut Palovin for their hard work in drafting the answers to those questions.
We're also indebted to Dr. Dupree Mekbing, second of his name,
and Dr. Astrid ATTUNE for the guidance and expertise throughout the webinar.
And finally, a round of applause for Caroline and David Covini, who provided the artistic direction and scenario for this webinar.
We hope that you enjoyed this webinar about ATTUNE. Don't forget that you can ask any additional question you might have in any language by clicking on the link below. We will try to answer them as quickly as possible.
We will also be sharing with you an e-booklet that contains all questions and answers from the initial survey shortly. You can leave your feedback on the quality of the webinar to help us in improving the quality of the next ones. Take care and stay tuned.